future of One Health, innovation and opportunities. Before we start the day's program, we gratefully acknowledge our sponsors who have made this TRIMA 2024 as grand as it is turning out to be. Our platinum sponsors are Kim's Health, Canara Bank, Calculus and SBI. Adani Ports and Logistics is our gold lead. Terumo Blood and Cell Technologies and Main Concord. Kinfra, KSIDC, Muthoot Fincor, Rajiv Gandhi Center for Biotechnology, Duke's Lodge and Nikki's Nest, Sri Chitra Tirunal Residential Central School, Trivandrum Technopark, Synthite, NIMS, Swiss 10 Credai, and the Lulu Group are our valuable silver sponsors. As associate sponsors, we have KFC, Oh My Gene, HLL Life Care Limited, Muraliya, and Federal Bank. And as supporting sponsors, we have Aspinwall and Adtech Systems Limited. As media partner, we have Asianet Enterprise. And we are happy to share that all of yesterday's proceedings were streamed live on Asianet Cablevision, and this will continue for today as well.
In her current role, she manages a global unit which provides solutions for life sciences customers in clinical development, regulatory and safety operations.
And good morning to my fellow panelists. Really happy to be part of this discussion here today. So, One Health, I think, is something which is definitely an imperative for all of us. And there are various angles to how we are addressing the needs of One Health. So today we are going to focus a little bit on the innovation and the opportunities in One Health. So I'll talk a little bit on the need, a little bit of focus on antimicrobial resistance, AMR as we call it. One Health, the approach for industry, and also the individual and collective responsibility. So the why, the who, and the what. As we have clearly seen, and COVID-19 brought it, unfortunately, very starkly to us, that several pandemics, endemics have zoonotic causes of origin and contagion, right? We have seen that. And the reason this is even more, quick in its spread, it's the global trade that we see today. It's easier, but it also has its challenges of contamination in the entire supply chain. Integrity is a big problem, or it's a challenge, let me put it that way. And during environmental disasters, more of animal-human contact can even lead to further spread of infections. Today, pathogens of pandemic potential are getting stronger due to antimicrobial resistance, and that's why I think some of us will focus a little more on that area specifically. Environmental disasters have 60 to 70% greater impact on pandemic situations, and I think we've lived through some of those. Now, the solutions for these zoonotic and environmental originating problems need different answers than conventional mechanisms. For example, if you're talking about mosquito, initiated kind of diseases, there was one solution which was, the way the mosquito itself was, the breeding of that was to make sure that a particular cause was being eliminated in the mosquito. So the breeding of that then ensured that it was, the origin of that disease was eliminated. So a different way of looking at solutions is what is needed. Another important aspect is this cannot be done by a single entity. It cannot be done individually. I think the title has been rightly put, one for all and all for one. And that is why the whole One Health concept of collaboration across healthcare, agriculture, environment is needed to have an effective, holistic solution for One Health. Just to give a little introduction, I'm sure many of you are familiar with antimicrobial resistance, but the reason, and this is a picture from the CDC, right? It talks about how it spreads, why is it increasing, and there are several reasons, but some of the key ones. The pandemic associated incorrect or overuse of antibiotics and antifungals. And we've seen that in COVID-19, right? So many people were just prescribed a whole cocktail. Some of them were needed, some of them perhaps not needed. So what has happened because of that? Healthcare, the other reason, healthcare associated infections. I know my doctor family and friends don't exactly acknowledge this, but I mean, not that they don't acknowledge it, but it's something that doesn't get discussed enough. Resistant hospital onset infections and deaths both increased at least 15% from 2019 to 2020 among 7 pathogens. Indiscriminate use of antibiotics in animal and poultry. Today the poultry industry is such a big industry. There's a continuous use of antibiotics and it is in the food chain. Another area in India, unfortunately, I think Kerala is a little better, and I'm so proud to say that because it's part of my roots. But the fact is, it's a serious problem for us, is the OTC availability of antibiotics, antifungals, which are given without prescriptions. So, One Health, I mean, we know it's a quadripartite MOU. We can see the Food and Agricultural Association Organization, the WHO, World Organization for Animal Health, the UN Environment Programme, and of course the WHO, right? So I'll just introduce some of the industry innovations and societal imperatives, and then we have an interesting panel discussion where you will get many more insights on this. So One Health approach, the Center of Disease Control in the US, CDC, some of the key targeted actions in alignment with One Health that they talk about. The first is tracking and data. If you don't know what the problem is, we cannot attack it. And that's why it's important to have investment in tracking the data, first of all. Right? When we talk about those 7 pathogens, that has come because of the tracking. And then the data, the collection, the cleanliness of the data, the aspects of analysis become so important and everywhere, whether it's AMR, whether it's the supply chain, food chain, several other aspects. The second is, how do you prevent infections rather than having it and being treated, right? So the focus has to be, you know, in the old days, I think there were some intuitive things which we knew, which we tried to do to prevent things because perhaps cures weren't as easily available. Today, I think we have become a bit complacent because treatment is more readily available. But I think it's important to go back to basics. How do we prevent infections? Right? So I'm part of the life sciences industry, so some of the aspects that are important is development with equity, diversity and inclusion for treatments, voluntary licensing. Why is this important? Because we focused a lot on, do you have a US FDA authorization? Do you have an EMA authorization? Do you have in specific countries that you are? But really, something can come out of an African country which unfortunately doesn't have enough authorizations that it needs. So development with equity is an imperative. Affordable access to quality assured medicines is another way to prevent, the whole health index itself improves. Another area is safe practices for hospitals, food suppliers, and individuals. I think there's a very interesting book, or several books, with Dr. Atul Gawande has written, which I find very interesting. Despite being a renowned and experienced surgeon, he got people to evaluate the practices in his own hospital. And one of the key things that his focus was on HAI, hospital, raised infections. And I think some of his books are very interesting. It's a must read, I would say. The Checklist Manifesto and even his original Complications, etc. I think it just gives some of those perspectives of how you can do, it's important to have the rigor of good practices to prevent infections rather than having to deal with it later. And then there are others like guidelines for antibiotics, antifungal development and usage, the environment and sanitation, vaccines, therapeutics, and diagnostics. And the last is, aspect that I wanted to touch upon is what can India and our communities do? So in tracking and data, India is known to be an IT hub. We have, actually invented outsourcing or partnership with key technology and scientific companies for solutions. There are many digital solutions and scientific bodies for monitoring at a nationwide level. We can bring several solutions in the area of digital support, for example, for medication adherence. There are some things we have worked on. Novel methods of supplies itself, such as direct-to-patient supplies, can reduce burden in long-term care. There are many such interventions that can be brought. These are just some examples. Preventing infections, hospital infections, NABH accreditations, and there are many other standards that are now being looked at, as well as the aspects of hospital waste management and reduction of device-induced infections. For example, UTIs come because of the catheter insertion. So there are so many such device-induced infections. How can we prevent them? How do we have a rigor of the practices to ensure these don't happen? Hygienic practices for food management, right? The cold chain, how is it tracked, how is it managed? Timely treatment for pets and domesticated animals. There are so many diseases that come from pets, right? Tick-infested diseases. And if we are not taking care of that on time, it's part of our responsibility to make sure that we do. I think the guidelines for antibiotics, antifungal usage for animal rearing and poultry farming. I'm very happy to see that there are responsible organizations who today now look at, managing poultry with not just feeding them all the time antibiotics. So you get antibiotic-free chicken, for example, and it's good to see the modern thinking around some of these, and responsible thinking, I would say, because that is something that affects the ecosystem. Supply chain, digital solutions and control for inventory management, shelf life of medicines, digital supply tracking for drug accountability, several such things, we have solutions and we can take it forward. And one maybe, undervalued area is also education, right? How do we make it part of our DNA? And I think all of us as a community owe responsibility to see how we can contribute. Maybe like, for example, we work with academia to introduce curriculum in colleges. I'm sure all of us have good means to contribute to education, and in CSR many organizations are doing that, and of course the governmental agencies. But what can we do to make the One Health education available is something that we want to see. So I just wanted to give an introduction, and we will get into our panel discussion now. I'll just give a short introduction of my fellow panelists. Dr. Anandkumar, he's the co-founder and CEO of Bugworks, an Indo-USA Australia biotech startup. They are working on tackling the massive problem posed by untreatable bacterial superbugs, which are implicated in hospital community infections and bioterrorism situations. More recently, the company has also forayed into the design of differentiated immuno-oncology assets targeting several solid tumors, and Bugworks hopes to make a massive impact on humanity by addressing large unmet medical needs while making its products affordable and accessible to all. His entrepreneurial journey includes being the co-founder of CEO of Cellworks India. He is the co-founder of Ignite Lifesciences Foundation, co-founder of Impress Healthcare, founding MD of Spin Circuit Technologies and Magna Design. Anand is a globally recognized key opinion leader in antimicrobial resistance industry, and that he is part of important organizations which are, making an impact on AMR. Mr. Chetan Makam serves as the Senior Vice President and General Manager Global Blood Solutions for Terumo Blood and Cell Technologies, as well as he is the Managing Director and Board Chair for India subsidiary Terumo Penpol Private Limited. Chetan brings over 20 years of experience in creating, developing and growing business in the highly regulated medical devices market and geographies, and as well as a unique perspective and understanding of various cultures and people. He is an ardent advocate of improving the access and delivery of blood components and biotherapies to all who need it, and often writes about blood being the essential medicine in all forums. He has also worked with Niti Aayog in aspirational districts to improve blood ecosystem and to promote voluntary blood donation programs. I'm not going into their several academic, both of them are, have several degrees to their name. Our third panelist is Dr. Jeyapal Vidyadharan. He is the director of Hridayalaya Heart and Robotic Research Center, which has been in place since 2023. His educational background includes graduation from Trivandrum Medical College followed by several postgraduate degrees. His passion is to integrate artificial intelligence and robotics in healthcare. So we hope we have an interesting panel discussion for you today. Can you tell us why you see the need for One Health as a key imperative for us? And maybe we can start with Chetan.
Sure. Thank you, TRIMA, for the opportunity to be here and share some thoughts. When you think One Health, and all of you have probably read about it. If you haven't, please go to the WHO website and read about it. It's a very interesting concept that we need to take all aspects of the humans and our ecosystems together. So when you say why is One Health important to us, I start thinking about it from a human perspective, which is, what is your lifetime value? As an individual, what is your total lifetime value? And if you're not healthy for most of your life, how are you getting to that full potential that you can have? Number one. For governments and societies, if they are spending a lot more money on keeping you healthy or providing you with medical services, where else are they cutting from? Is it taking from infrastructure? Is it taking from education? Is it taking from something else? And finally, we live in a world of ecosystems, right? You have your own ecosystem, each of us. Your family, your friends, your work, your leisure. Our families have their ecosystems, companies have their ecosystems, countries do, and we live in this world of cross-functional and intersecting ecosystems. And are we being additive in value to those ecosystems, or are we being detrimental to those ecosystems? So when I think of health, it's a cornerstone of what we need to accomplish. And in my opinion, and I've already talked about this and Rosemary mentioned it, blood is essential medicine and one of the cornerstones of this healthcare system. So I'll stop there. I'm sure we could go on for a long time about what One Health is all about.
Thank you. Thank you, Chetan.
First of all, I am thankful to TRIMA for giving me an opportunity to talk about One Health aspects. Last month, that is April 21st, we had a international conclave for health that is called healthcare singularity. I called doctors, engineers, researchers, and those who are interested in artificial intelligence. Same place, same hotel. And this is, I think, I don't know, it's a miracle, a continuation of the same topics I got next month from TRIMA. So I wondered why it is like that. Why they have selected this a good topic regarding artificial intelligence. Let me talk something regarding the interconnectedness of human, animals, environment, and there is an intersection called One Health. All these three joined together at a place. There, it is surrounded by the emergence of artificial intelligence and robotics, so that each entity can be considered together. That is One Health. And recently, I read an article regarding Nigan Shah. He is an Indian doctor, professor of Stanford University, data scientist, now a leading figure in biomedical informatics. He has discussed regarding in-depth artificial intelligence and healthcare. And he is of the opinion that there should be a balance between artificial intelligence, or this is called the new innovation, and systemic disease. A balance should be there. Not by overtaking, it should not be there. AI should not overtake our healthcare. So the doctor or the human should be the person responsible controlling the AI. That is what his conclusion. And another important question regarding emerging technology. Can I answer that or next question? Come back. This is a basic introduction regarding AI in single health. Okay.
Thank you. Good morning, everyone. I want to appreciate TRIMA for choosing One Health as a subject. I think they need a round of applause first, because this is, a management association has many management topics to choose, but they chose One Health. So the United Nations General Assembly this year, ladies and gentlemen, 3 topics are going to dominate humanity: wars in Ukraine and Israel, climate change, antimicrobial resistance. And climate change and antimicrobial resistance coming together is One Health. For you youngsters who are sitting here, why is this topic so important? For every 1 degree rise of temperature, bugs are becoming much more active. So in the laboratory, when we work with bacteria and viruses, rising temperature makes them more intelligent. Billions of years of evolutionary intelligence in organisms come back now because of increasing temperature. Increasing temperature are melting snow in Antarctica, in the Arctic, in the Himalayas. These are snow blocks that froze billions of years ago, and when they melt, organisms in those ice blocks are coming into our water stream. So everything is connected. The connection of animal health, human health, and the very environment we live in is One Health. That's why as a youngster this is important to you. It's not a time pass subject. It's such an important subject. The easiest way to explain One Health is COVID pandemic. Humans get into areas, interact with bats, with pangolins, with animals that we are not supposed to interact with, that are reservoirs of harmful viruses and bacteria that were peacefully coexisting because we never went in there. In 40 years, in just 40 years, 2 generations, as humanity, we have destroyed the environment. Billion years of humanity got completely changed in 40 years. So we owe it to our next generation to make One Health a very important aspect. More recently in Kerala, in Kuttanad, 2 weeks ago, I think you all had a bird flu and they had to cull many ducks, lakhs of ducks. That is One Health, ladies and gentlemen. That same area, Kuttanad area, with the increasing temperature, I think it was very hot in Kerala, much more hot than normal. Sudden changes in temperatures and environment, the bugs start behaving crazily. They get into these ducts, and normally they are friendly with these ducks, but they become virulent, pathogenic, dangerous to that duck. The human who's interacting with the duck has a good chance that that bug will come from that duck into the human. And then the human comes and releases it, the next is COVID. Thankfully, in that case, the bug in the duck didn't jump to a human. When it jumps, it's called zoonotic. She mentioned it in a talk, like what happened with COVID, right? So it's so important that climate change, antimicrobial resistance be looked at together, right? Why is India a big problem, but also a good solution? We abuse antibiotics. I can buy antibiotics like chocolates. By the way, the only state in our country with the best antibiotic policy is Namma Kerala. Only state. I cannot walk across and get a meropenem or tigecycline, right? And what are doctors most worried about? We have a doctor here. I have my doctor nephew from PRS hospital here. What are doctors most worried about today? Not about cardiac or stroke or renal. If the patient comes to the hospital, they may be able to treat them. Post-surgery, patient picks up infection and you don't have enough antibiotics. No bullets left. No bullets left because the last innovation happened in 1960s or 1970s. We abuse antibiotics as a society. The same antibiotic that has to save me goes into the poultry industry. And the manufacturer of the antibiotic industry is pumping those antibiotics into the water stream. So the bacteria is smart. If you expose your weapons to the bacteria, virus, fungus, guess what? If you expose your weapons, they generate resistance. Therefore, proper handling of anti-infectives, proper handling of the environment, and please understand, particularly youngsters, increasing temperature is not only uncomfortable and you have to turn the air conditioner on. It is promoting One Health problems. So I think it's great that we have come together and that TRIMA has used this as a subject. I'm very passionate about this subject because this will destroy 100 years of industrial revolution. One topic will destroy it. It's One Health. So great opportunity. Thank you.
To Chetan, you talked about the importance of the blood ecosystem. Can you just share with us how it is such an integral part of the One Health, objectives?
Yeah, absolutely. Most people don't think of blood unless they need it, and then they're running around saying, who can donate blood for my relative or for my family member who's in the hospital. So even before I start, all of you who are here, the youngsters and those who are young at heart, please donate blood every time you can because you never realize the importance until you actually need it. So let me give you a few statistics. In India today, 1.3 million women die during childbirth. 50% of those women die because there is no blood available during postpartum hemorrhage for them. So imagine the impact of 600,000 women and the impact on their families. You talk about One Health and we can talk about all the big macro things, but when it comes to that one family, what did just happen, right? We also look at the next bugs, like Anand was talking about. There will be guaranteed one more pathogen. What are we going to do about it? How are we going to keep that away from not just the food supply, from our blood supply, from our healthcare, all of those different pieces, right? I think as we begin to think of how we are addressing various issues, I just brought up the maternal health, but think of the non-communicable diseases as well, surgeries. You're looking at the requirement of blood for those surgeries because of our lifestyle habits that are generated because of the food habits, right? So as you begin, this is why I kept talking about the intersection of our ecosystems. If you are not aware of the intersection of your ecosystems, we will be doomed to repeat it. In fact, when you look at all countries around the world, pathogens and their impact is probably the #1 fear that most governments and countries have, and they're taking active steps to do it. And we are in the forefront of some of it, looking at vaccines now even for animals, not just for humans. How do you vaccinate animals so that they do not get those bugs you were talking about with respect to the ducks or the pigs or the cows or everything else? So I think there's a lot to be said here in terms of how we engineer or address the health issues that are in front of us. So even though there's a lot of antibiotics and other things, I look at it from the prevention side of things, or how do you not let things get so bad that now I have to go find a super antibiotic? How about I try to fix it up front? Because, you know, whenever you start thinking, and as I was looking at One Health and sustainable health, one thing that came to mind was just like we talk about plastics, right? Reduce, reuse, and recycle. Why not the same one for One Health? Reduce your antibiotics. I'm sure you can't recycle them, but let's start with at least reduction in some of those things that, that affect us.
Thank you, Chetan. I think an important factor is prevention, right? And the blood ecosystem, vaccines to, get us to that stage is such an important aspect. Coming to a different aspect of technology, Dr. Jeyapal is very passionate about the emerging technology. If you can share with us, Dr. Jeyapal, about how does emerging technology help you in the field of cardiology?
It's a wonderful question, I can tell you. See, before I want to talk about that, because antibiotic resistance, it's a wonderful area. Wonderful area, because I had an injury 5 days or 10 days back. A big injury because during cycling, I got an injury, and my wife started to, please take antibiotic immediately. Otherwise, you have to cut your leg. What is that? I never took antibiotic. Within 5 days, it is okay. If you are, I will show you in person that area. And we can't find anything there without antibiotics. Now, what happens is antibiotic is sold all over the medical shops. It's not those. Only after getting prescription from a doctor, you should take. Because you will get immediate relief, but your body's immunity disappears rapidly. That is the bad aspect. Now, madam's question I am going to answer. See, now, emerging technologies are there. Genomics and another is metagenomics. Genomics is study of an origin of one gene. My gene, your gene, everybody's gene. That is genomics. But what is metagenomics? Genomics is the study of multiple organisms like bacteria, fungus, virus. All these together is called the metagenomic. This is that is my gene. I think they are planning to develop in Kerala regarding the genetic study, which is very important for development of healthcare aspects. Next one is big data analysis. It's very, very important. In Kerala, I can tell you, nobody is having data. Everybody has patients, but no data. You ask any doctor, can you tell Dr. Jeyapal, how many patients, the hypertension you are seeing? They are coming, going. No, you should not tell it. I have 96 patients yesterday with severe hypertension. How do you tell? You should have a data. You should have a database. You should have an analytics. Then you can predict using machine learning. That is what I want to highlight. I don't want to talk more. Remote sensing. And there are UAVs or vehicles are there. We will go to the atmosphere, collect the data, take the photo and give it to you. This kind of things are there. IoT and wearable, that I want to highlight little more because this is, everybody is having. Because 50,000 rupees there, you can buy, you can see the ECG, you can see the pulse oxygen. This is not approved by US FDA. Am I right or not? Not approved. But I can show you another important watch which is approved by US FDA. This is used by doctors because it costs 1.07 lakhs. When you wear this watch, this watch will give you information regarding your health status. Dear doctor or dear patient, your heart rate is going up, go to see one doctor. That give a message. Another, he will take the ECG. Not only take ECG, he will predict that you have atrial fibrillation or not. Your in the English, that is called atrial fibrillation. And you immediately, your sudden cardiac death is there. So it will prevent sudden death. The other won't prevent. That has no license. License. Another important thing is, he will give you the blood pressure, take the blood pressure also. That is fantastic. They will take the BB, it is not at all correct. The USFDA not approved. This will give you 138/84. If you check with anybody, it will be correct. So this is the beauty of, this is Internet of medical things, not our IoT, Internet of medical things. This is a medical thing. And another important point, it will predict the myocardial status. You have hypertension or a stress index. Then another standard deviation of between two normal beats. Mean deviation, everything will be 20 parameters this watch will give. The other will give only time, you can walk, you can tell 100% oxygen you have consumed, like that. That's good for ordinary people. For patients, this is ideal. Another one is blockchain. This is one, if I talk in this artificial intelligence, somebody will ask question regarding the what is called how your data is secure. This is called the blockchain technology. When you enter a data into that, you are the custodian, the patient is the custodian. There is a password for that. Using that password only you can, and I can't see your data. If you say, Dr. Jeyapal, my number is 4946, just open it, you can see. Otherwise, we can't. It's like our lock key and open and take the money and go out. This is called blockchain technology. It will come within 2-3 years. Nothing, nobody, you think it is an impossible thing. It will come, definitely. That is why we started in Kerala this kind of activities. Gene editing and synthetic biological things we can synthesize. That is our, what is called the vaccines.
Yeah.
mRNA vaccines. This I know the Nobel Prize winner is our Rosemary and Catholic, the Kariku. They got Nobel Prize and found the mRNA vaccine and saved a lot of lives.
Yeah.
Negative points don't talk anything. This I have seen my majority of friends, doctors died due to exposure to COVID virus. I really pathetic about that because we took a lot of time to develop that vaccine. But what is that vaccine? Everybody will think vaccine, so many patients died. Never, it won't die. But if you have something in your body that is immune system is weak, following antibiotic intake, that will produce problem.
I think Dr. Jeyapal, you gave us a good view of some of how technology can help us in the journey to build immunity, to build more personalized and precision medicine. So thank you for that. And let me move to Anand. We touched upon it a little bit earlier, but why is affordable access to quality medicine so important? And how can the life sciences industry help in the key challenge of AMR?
So we always speak about India as the one of the worst countries in the world for health. We are the diabetic capital of the world, we are the cardiovascular capital of the world, we are the infection capital of the world. Let us change gears. Let us change gears. The best solutions for the world in many of these diseases are coming from India. Classic example was in COVID. Did you know that 60% of the world would have died of COVID if they didn't have access to our vaccines? From Serum Institute of India as well as from Covaxin. Because the mRNA vaccine, which is a fantastic vaccine which got a Nobel Prize, was invented for the white man or the white woman. We can't afford it and it needs a minus 20 degrees cold chain. How can it come to Kotanad with minus 20 degrees cold chain? It's not going to happen. So the affordable, accessible, intelligent solutions are coming from India. So when I go in these global conferences and they say, man, India, you guys abuse antibiotics, dirty hospitals, etc. We turn around and say, we saved 60% of humanity through our vaccines. That's the story. These are not junk vaccines. These are good vaccines. Affordability doesn't mean lower quality. We are not Chinese. Affordability does not mean lower quality. It means we have understood manufacturing scale, and also our government, with the Honorable Prime Minister, made this a priority to make India the vaccine capital for the world. We have to appreciate it. We always, it's easy to talk negative about governments, but we have to appreciate and take pride in what we are doing for the world. Let's talk about One Health, AMR. Which is the worst country in the world for AMR? India. We have the worst bugs that are resistant to all antibiotics. There are very few antibiotics. Why not convert that disadvantage to an advantage? Companies like ours, we are one of 4 companies in the world working on a novel antibiotic. Guess why we are successful? Because we test our antibiotics on Indian bugs. Once you test it on Indian bugs that are multi-drug resistant or pan-drug resistant, then when we test it with bugs from UK and US, those are 5-star, 7-star bugs. Ours is Nardan bug. Right? Once you learn how to adapt your solutions for the tough bugs and the tough One Health challenges in India, what works in India will work in the rest of the world. Get it? Which is why, as youngsters, your next generation, I always address you guys. You're busy with movies, etc. But you should realize that our country offers incredible solutions, affordable and accessible solutions. What is the point of me creating an antibiotic that's $5,000 when my people cannot afford it and they're going to die? Right? If I was funded only by a United States venture capital company, they're only interested in, they tell me, invent an antibiotic, I can charge $25,000, 100,000 patients, I'll fund you. I'm interested in a $200 antibiotic for 1.4 billion people. And let us not forget, ladies and gentlemen, there are 8.3 billion people in the planet. Most Western countries will make up maybe 500 million of that. So our country has the ability to serve 8 billion people in the planet. It's awesome. I wish I was much younger. Right? It's awesome as you youngsters. Don't waste time on movies. Right? Avesham can wait. Right? The fact is, solutions have to come from here. So whether it is diagnostics, so that a lady who's suffering of UTI in Chhattisgarh, or one of those ladies who's dying of a bloodstream infections that Chetan spoke about, you can diagnose a problem and say it's a pseudomonas. Devices to prevent the spread of infection. Affordable antibiotics, novel antibiotics. India is going to be the place. I want to leave with one very interesting thing. Do you all know that the first antibiotic was invented by Alexander Fleming, right? Nobel Prize, 1920s. It's been 100 years. Since when Alexander Fleming invented the antibiotic, the average age of humanity was 26. We were dying of small wounds, a small prick of a rose bud, a small scratch, a small infection that doctor got when he fell off his cycle. We were dying of those. One invention, antibiotic, changed from 26 to 40. This is the power of innovation. This is the power of science to completely dramatically create an impact. And today from India, if you can solve big One Health challenges from here, we are not anymore problem makers. We are solution providers for the world. You, me, all of us are solution providers for the world. Exciting times ahead. Thanks.
Thank you, Anand. That really inspires. That I think we have a culture of science and technology education in this country. They are definitely being used more and more by the life sciences, health tech, industry, biotech. So coming back to you, Chetan, I mean, on that same note, what are the opportunities for India and how can we play a role for One Health?
I think the opportunities are endless, as Anand just spoke about. I think your only limitation is your imagination at this point, right? For those of you who are interested in watching innovation in the blood space, you can drive down 20 minutes to our headquarters right here, opposite Sri Moolam Club. We've got a corporate headquarters for India, and we do some amazing things. We talked about CAR T cell therapies. Most cells used in those therapies are collected on our machines. We have one of the largest blood bag factories right here in Puliyarkonam. right? And we have a huge R&D folks, and when you look up in the night sky, if you see a green Terumo, that should be your guiding light, right? So anyway, I have to plug our company a little bit since they, got me all the way here. But when you start thinking about opportunities, number of different things, I think the fact that Anand referred to it, which is the youth dividend. I think we've got such a great talent, whether it's engineering, science, business, you name the field, we've got the talent, which means what are you going to do about it, right? Because every time you think about what do I have, I always ask the people, so what and who cares? So I have a youth talent, what are they doing? And we'll do our part to create those jobs and create those opportunities for people to succeed, number one. Second, we've got a dedicated, as I've worked with lots of different states in the country, every state is now behaving as a business. I get solicited from bureaucrats in every state to say, can you come set up here or what can we do, right? Third, I think we all focus on make in India, but I'd love to focus on innovate in India, right? Because given the talent and the intellectual horsepower, we should be creating solutions for the world like Anand said. And we spoke about it at Keralium a couple of months ago. And the final thought on what are the opportunities for India are public-private partnerships. Governments are very interested in leveraging the expertise that each of our companies brings to create those opportunities, create those investments, right? And finally, I think a lot of this is your individual motivation. What are you going to do about it? When we look at innovations, we say, are they compelling and accessible? Compelling means they make a difference, and accessible means everyone who needs it gets it, right? So for us, access and delivery is what we look at, and each and everyone in our company is thinking, so great, we are making this invention, who cares and so what? So I want each of you individuals to think, when I'm doing something, so what and who cares?
Yeah.
From primordial level
Right.
itself rather than primary level.
Okay.
Primordial means you have no disease. Because somebody will come to say, sir, I have diabetes, small diabetes, sugar is only 140. But they don't know that it was there since 5 years. 5 years it started diabetes. That is, it is called the primordial prevention. That is the impaired glucose tolerance between 100 and 120 is there. That is pre-diabetes.
Right.
This kind of things can be detected by machine learning and artificial intelligence. That's why I am focusing on this aspect. Doctors, if you say machine learning, they, what is this machine learning? Nothing. Because we have brain. Why should we depend on artificial intelligence? No. This is a public, for the public, this kind of preventive measures are very, very important. See, hypertension. So I tell my hypertensive patient not to go to a doctor. Why? If they go to a doctor, they will get hypertension. This is called iatrogenic hypertension. Doctor-induced hypertension. So this kind of variables in your body, you can wisely detect your hypertension and apply preventive measures. Start walk from here to about 6 o'clock to 7 o'clock. You walk. After 3 months, your BP will be under control. Still not controlled, you change your dietary patterns.
But should we bring a curriculum even in medicine for adoption of technology?
Yes, because this is a wonderful technology. Anybody can use artificial intelligence. No, it is not restricted to doctors, engineers, or like that. Human beings. They can go through that and get all the information regarding, this is called the large language processing, LLM is there. So you ask in Malayalam, they will answer in English if you know. If you know Malayalam, he will talk in Malayalam. This is the very important development of artificial intelligence. So if you know only Japanese language, he will talk in Malayalam. So this is called the language transfer. Text is converted into sentence, sentence is converted into words, words is converted into tokenization. So easily we can billions of pages, he will analyze and give the answer. That is why a doctor appeared for an MRCP examination. He failed. AI fellow passed. Why? Because he has everything in his memory. We have only few things in our memory. That is why artificial intelligence will come as a friend, not as an enemy. I can tell you to all public that this will not overtake you, and it has sentimental attachment also. If you cry, he will understand your feeling. That is called sentimental analysis. And if you laugh, he will also laugh. Sir, you are Dr. Jeyapal, are you laughing? How that's called speech recognition is there in Python language. I have entire study regarding Python, machine learning, deep learning, LLM, everything through
I think we can see the passion that Dr. Jeyapal has. I think what we need to do is bring some of that passion to a lot of the medical professionals.
Yes.
Robotics, of course, has come into surgery in a big way, but some of what you're saying on other areas as well. I'll come back to Anand, and maybe we'll try to keep this probably the last, because we talked a lot about what India can do, what we can do as a community. But I think, you know, one area we didn't touch upon, which maybe I'll request Anand to cover, is in what ways can One Health contribute to achieving sustainable development goals?
So that we don't bore the audience. Sustainable Development Goals comes from the United Nations that says for humanity and animals and environment to move forth, these things need to happen. That's called SDG. Thankfully, within the Sustainable Development Goals, there's a rule number 3 point something, I won't bore you, and rule number 17 point something that says, as a human race, you cannot move forward if animals and environment and humanity don't work together in a synergistic pattern. They wrote it even before COVID, and now we know COVID happened because it's One Health, and your duck problem in Kutanad and many other problems in the world are happening because of this issue. So, Rosemary, it's become imperative that Sustainable Development Goals, the reason why so many babies die, that Chetan spoke about, blood infections and otherwise, the reason why India loses 4 to 5 lakh people per year owing to hospital-acquired infection, even in the best of our hospitals, best surgeons, best treatment, but you don't have antibiotics to save them, or antifungal to save them. So all of this is showing us that we have a great opportunity to contribute towards it. I think from an SDG perspective, our technology, Rosemary's technology and sciences are going to help in a big way. India's biggest strength has been information technology, IT. India's strength has never been science. But now in the last 10 to 15 years, I see major changes happening in India. I'm actually very proud of what the government is doing to infuse science. You know, leave politics aside and look at it purely from what we're doing. 8,000 startup companies in biotech have been formed in the last 12 years. How many? 8,000 in India. How many will succeed of that 8,000? 2%. That's a success rate, 2 to 3%.
It's still a good
but
success.
In that 8,000 are people who are trying to diagnose the next pandemic, to build vaccines that are affordable before the next pandemic comes, to build antibiotics that can keep you, me, and everyone safe, to do separate medicines for animals, separate the medicines from animals from separate the medicines from things. AI, my background, by the way, ladies and gentlemen, is not in science. I'm a semiconductor guy. I used to design computer chips. We are using those same algorithms that we use for computer chip design in studying bacteria. Look at what an interesting world it is. You can be an engineer who did computer science or electrical engineering, and you can look at a medical problem with a completely different prism. So I think doctors, engineers, scientists, IT people are all going to come together. Doctors who don't understand technology and technologists who don't understand life sciences will be irrelevant in our society. Thank you.
So that's fantastic. I think just to sum up, a fantastic discussion, and I thank my fellow panelists. I think it's clear that we have to work together, whether we are technologists, whether we are medical professionals, whether we are life sciences industry, biotech, and we should leverage the global, wealth of science and technology to bring together solutions which will really help us in the One Health drive and the One Health approach. So thank you very much. I'm not sure if there's an audience question, but we are happy to take maybe one or two.
It was a brilliant session. We have eradicated polio, excepting in Afghanistan and Pakistan, I think 6 cases. So can't we start eradicating all diseases? Number one. Not at all relevant to the topic today. Last 3 wars going on. How many people we have killed?
I think we are here to find how to keep people alive. Let me answer the second first. And the first one, maybe Anand, if you could take a shot.
I think it's an important question that you're asking. One of the largest contributors to One Health problem, I really want to talk to the youngsters because I feel they miss out a lot. And you are our country's future, youngsters, is the war. Every time a war breaks out, like it happened in Ukraine and unfortunately in Rafah and other parts of Palestine, One Health problem becomes horribly worse.
Absolutely.
Because war disrupts people. Millions of people are put together. There is fire, there's destruction, there's gunpowder in the air. All these things promote resistance in bacteria and fungus. When you put 1 million people together who are under one shelter, even if one person has a disease, it spreads. Which is why war and climate change and One Health are all part of the same nexus. So we can't prevent, I hope we can prevent wars, but the wars are the biggest culprits today, sir, to your question, to make One Health horribly go wrong.
Yeah, I think Chetan had a point.
Yes, so every one of us knows we can't, as individuals, prevent war. Unfortunately, those dynamics are very different. What we're trying to do is keep people alive. So today, if you were to compare with World War II, thanks to advances in how we manage battlefield casualties, if you can get that wounded person back to the field medical camp within half a day and back to base hospital within 24 hours, their chances of survival are 90+% because of how we have got the medics in the field, and as folks who supply equipment for collecting blood around the world, we do not discriminate between who's right and who's wrong. We provide, the life-saving therapies that we can. One of the things that we've been working on, and maybe others as well, is instead of taking liquid blood, if you were to take plasma, which is freeze-dried, and supply it to all the medics, you can actually add water in the field and, like a soup mix, create plasma that can be infused right at the site of the injury, and that allows people to be saved. So I think we have to go back, and this is why I talked about innovation, is there are certain things in our control and certain things that are not. And we'd like to always focus on things that are in our control, because now we can actually keep people alive despite all, whether it's war, whether it's a natural disaster, whether it's anything else. So I think let's focus on how we innovate, while others who are better than us, definitely better than me, who can prevent war.
Yeah, I'd just like to add that, I just wanted to say that technology can also help by, preventing misinformation. Today, there is technology to spread misinformation. I think all of us as IT should be committed to making solutions which prevent misinformation, which sometimes is the root cause of wars. So that is one way I thought that we should contribute.
I fought 2 wars. It's mentioned about war. I can tell you, other than the fatal casualties which took place, anyone who was injured, none of them died.
Fantastic.
They were evacuated in time. They were taken care of by our Army Medical Corps, and it was fantastic. I remember a guy who got his entire stomach out.
Wow.
He tried it,
My
and
gosh.
the first aid was given, taken to hospital, he survived. Perfect.
So 3 cheers to, the medics in the army. I think they provide an invaluable service. So thank you, sir, for what you have been part of. Colonel, thank you, Colonel. My dad was also in the Air Force, in the founding Indian Air Force of this country. So I truly appreciate the spirit of our armed forces. and truly appreciate our Kerala state for being on the forefront of newer ideas and approaches like One Health, and I hope we continue this spirit of innovation and contribution to the right cause. Thank you so much.
Thank you. It was really an interesting and informative session and an insightful one as well. I request the audience to kindly give a great round of applause to the wonderful speakers who had been with the session, really absolutely in line with the theme for TRIMA 2024. May I request Sri Anthony Thomas to kindly hand over a token of gratitude to our keynote speaker, Ms. Rosemary Hegde. May I request Sri PRS Murugan sir to kindly hand over the memento to Dr. Anandkumar. I would like to request Sri Padmakumar sir to kindly hand over the token to Mr. Chetan Makam. And request Sri Setu Madhavan sir to kindly hand over the memento to Dr. V. Jeyapal. It's a special token of gratitude from TMA. We have tied up with We Grow, and the certificate is a symbolic representation of our contribution towards One Health.